Okay.
So I'm waiting for a day when I will have no patients in my OPD. I'll be the happiest person. I'm a doctor, but I want no one to fall sick. I think sleep is something, which is free, but the most important. All the good things in the life are free, whether it's oxygen, water. First line is that migraine is a disease of younger people. So when women come to me saying, doctor, I have migraine, when will it go? I say it will go when you become old.
Hello and welcome, guys. Welcome back to our latest episode of our podcast. Today we have Dr. Sudhir with us. He's a practicing neurologist. Let's get to understand him, his working structure, why he chose medicine and why neurology in particular, and also why did he take to running and choose a healthier lifestyle lately. Thank you, doctor, for agreeing to be on the podcast with us.
Yeah, thank you. So I think it's a very, very interesting question that why I became a doctor.
Yes.
So for that, the simple reason is in my entire family, there was no doctor. We had more than 20 engineers in our family and almost all the specialties.
Okay.
But then, just like every family, somebody can get sick. And you know how, everyone, we can't trust any doctor. This was in the late 80s when I joined MBBS. So my parents said, we need one doctor. Even I wanted to become an engineer only. But my parents said, no. If one person can become doctor, it is you. So I took biology and I studied, wrote all the entrance exams. And then, I got into several colleges, but CMC Vellore was the best at that time. So that's how I joined MBBS. And then that's how my journey of becoming a doctor began in 1989.
So why neurology in particular? I know it's one of the most complex courses.
Yes, that's another interesting, question. Because after my MBBS, I immediately joined for MD medicine at CMC Vellore itself. I got selected. So MD medicine, as you know, we get exposure in all the specialties. Like we go through cardiology, nephrology, gastro, everything. So I did very well in the MD exams also, and I was confident of managing everything. So my plan was to set up a clinic and start working as a physician. But I was not confident of neurology. So, but then as a medicine physician, I will be getting all specialties. So I thought, let me join neurology for a few months, learn the subject so that I can take care of all my patients who have neurological problems also. And I had no intention of becoming a neurologist. But when I joined the specialty as a non-PG registrar, after a few months, I started loving the subject so much that I wrote the entrance exam. That time only one seat was there. So, which was unlikely that I will get. I thought if I don't get selected, I will quit and go back to Bihar and start working. But I got selected and then I became a neurologist.
It was minor fluke, you can say.
Yes, means I wanted to learn the subject. So got in for a few months. And then, when you don't know something, it's scary. As you said, neurology is scary. And all of us felt, you can ask any doctor, the most complicated, the vast subject of all the medical specialties is neurology. But once we know the subject, neurology is like mathematics. You start loving the subject.
So every doctor I've had on the podcast is comparing their practice to mathematics. I don't understand the relation.
So you can imagine that mathematics is still, people say doctors are not good in maths.
Yeah.
But, that may not be true.
It never actually made sense to me because I assume even NEET has part physics and math in it, right?
Physics is there, and there's many entrance exams like AFMC. Now, it of course is NEET. But earlier when we appeared, so AFMC entrance and even CMC Vellore entrance, they had some kind of basic maths at the 10th level was part of the question paper.
Okay. So tell us what it takes to be a neurologist. Number one, how hard did you have to work to get into it? Because it's not cakewalk. Not everyone can be a neurologist. And two, I want to know what a day in the life of a neurologist looks like.
Yes, I think very interesting questions. So the first is getting into neurology definitely is not easy because the number of seats are lesser. If you look at other specialties like say cardiology, there are much more number of seats. Neurology seats are lesser. That is number one. Second thing is, once you study and get into the neurology training program, because there are lesser number of residents, you have to work, much longer number of hours. So as the residency in neurology is one of the toughest because when we worked, it was 16 to 18 hours of work per day. So per every night I was sleeping only 4 hours. You have 4 hours. Whether you can decide whether you want to sleep in that time, take a shower or have your food. So some days we missed shower, some days we missed the food, and some days we missed the sleep also. So that was like our residency of 3 years.
But isn't that contrary how neurologists say that you need enough sleep? and recovery, but when you are practicing or going through your residency, you don't get enough of it.
We don't get. So our internship and residency in MD medicine and then DM neurologist, it was like the sleep quantity kept on reducing. Internship, we could sleep 5 to 6 hours, which became 5 hours in MD medicine, became 4 hours or lesser in neurology. So we have no say, because when the patients come, somebody has to see, and who is that somebody? It is the residents who have to see first. Consultants will see the next day. So it is tough. But but another thing, the great thing about neurology, I'll first tell the plus points, not to discourage people.
Yes.
So the great things in neurology is that it is still clinical. Like many people say that, now when you go to doctor, they will write multiple tests. Without tests, they can't diagnose. Like if somebody has to diagnose diabetes, without seeing the blood sugar, how can you diagnose? Patient may be having, many symptoms. Somebody to diagnose kidney failure, we have to look at the creatinine. Somebody to diagnose heart failure, we need to look at echocardiogram.
Yes.
But neurology, most of the conditions till today, it is a clinical diagnosis. Like somebody has a migraine, like headaches.
Mm-hmm.
The diagnostic criteria is clinical. So somebody who's having headaches for more than 4 hours, up to 72 hours, with nausea or vomiting, they can't tolerate the light, then it is migraine. Same thing, epilepsy. People get this epileptic fits.
Yeah.
So, when somebody describes, like an eyewitness who has seen the seizure, that somebody had jerking of hands and legs, frothing at the mouth, tongue bite, it lasted for a few minutes, and then the person recovered. It is a seizure.
Okay.
Even stroke, stroke is like what we say is paralysis. People get paralyzed on one side. You'll be surprised that in the first few hours after the stroke, CT scan will be normal. It takes few hours for the clot to be seen.
Yes.
And with a normal CT scan, looking at the patient's condition, we can diagnose. So that is the most fascinating part, that we don't need to depend on the high-end diagnostics to make a diagnosis. And unlike, other medical specialties. And second thing is, earlier, the discouraging part earlier when we were training, we were told that, you'll only diagnose the patients, you can't treat.
Yeah.
Because there are no treatments. But that is not true. In the last, say, 3 decades, many new treatments have come, which are called as immunotherapies, then clot busting therapy for the strokes.
Oh, do you have that right now?
We have since 1995.
Okay.
So, but again, it is time bound. So those who get paralysis, if they come in the first few hours, let's say 4.5 hours after the paralysis, within 4 hours, if they reach hospital, we can give, injection in the vein and dissolve the clot.
Sorted right then.
Yes. And even if there is some delay and the vessels are blocked in the brain, just like how the cardiologists do angiogram, through the cath lab angiogram, the clot can be removed from the brain vessels also. So all these things came in the last, say, 10-15 years. When I joined neurology
this wasn't there.
In 1999, I didn't know that.
So I feel, especially with your practice, neurology in particular, you need to keep updating yourself more often than the other departments?
Won't say that. I think if in some departments, many things are already known.
Okay.
So not much to learn newly. As I said, in neurology, nothing was known.
Yeah.
When people came in 80s and 90s with a neurological problem, as other specialists,
it was more like just to confirm that out.
Just to confirm and tell the patient ki dekho, nothing can be done. But that has changed now in the last 2-3 decades. So because of that, because new treatments are coming now only, so we need to update more often. And brain, as we all know that brain is a mystery still.
Yes.
And why it's a mystery? Today we can replace any part of the body. Heart transplant can be done, lung can be transplanted, kidneys can be transplanted. You name a body part. But brain transplant? No. Nobody has been able to do. Even if somebody says, I'll donate my brain, put it in my mother or my father or my child, nobody can do it. So brain is a mystery. Many things in the brain is a mystery.
But many a times when these people come to you with issues and you say, like you said, there are many treatments, do you also not think that other organs are also connected to it? So the root cause can be not just the brain, but brain could be a victim.
Yes, I think this is a very, very important question. I think it's almost like MD medicine level question. And I wish that this is known to almost all the doctors. You are 100% correct.
Yes.
See, brain is at the mercy of other organs.
Yeah.
If the heart doesn't pump blood for 5 minutes or plus, the brain can get severely damaged.
Yes.
We all know people get cardiac arrest. And when you do CPR and revive the person, the heart starts beating. BP is normal.
Yeah.
But the patient is not waking up. Patient is still unconscious.
Brain dead.
And then the cardiologist tell them that, see, your patients, the attendants, that heart is totally normal, and then the attendants are foxed.
Yeah.
If heart is normal, doctor, and you are saying brain, there is no disease. So I said, yes, in the time when those 10-15 minutes when the heart was not pumping blood, brain got damaged.
Yes.
That is one example. But anything, let's say if somebody's kidneys are not working, urea, creatinine in the blood can go up, and that can go to brain, and that can lead to what is called as uremic encephalopathy. Somebody's liver is damaged.
Okay.
Same thing happens. Liver damage produces ammonia, and ammonia is toxic to brain. The person can be unconscious again. Simple things like low blood sugar. We all know blood sugar in a diabetic, if it drops,
Yes.
say below 60 or even as low as possible,
40.
they get hypoglycemia and brain damage can happen.
Yeah.
So there are many things. Infection can be in the blood, but it can spread to the brain also. What is called as septicemia or sepsis, where say bloodstream infection. So almost any part of body, if it is affected, it can have direct
some
or
collateral damage on the brain.
On the brain also. So brain is as good as the rest of the body. You can't look at the brain in isolation.
Nice. So since you touched upon the topic of migraine, I wanted to slightly dive into that and understand why so many younger people are prone to migraine issues right now. Is it the lifestyle or is it something hereditary? What exactly is the story behind it?
Yeah, first line is that migraine is a disease of younger people. So when women come to me saying, doctor, I have migraine, when will it go? I say it will go when you become old. So now leaving that aside, basically migraine is a disease of youngsters, more common in teenagers, 20s and 30s. And one of the basic origins, it is linked to be hormonal. So that is why about 70 to 80% of
women.
It's women. They are mainly women. But men also can get 20 to 30% of sufferers are men also.
Okay.
Now your question is very valid. Why it is becoming more common? The migraine triggers. So people don't get headaches every day. That is very rare. Some people do get. So the common triggers today are stress. And when I sit in the OPD, I hardly see a person who says, doctor, I am totally stress free and I am happy. So when they are unemployed, they say, because I am not having job, I am stressed. When they are employed, they are saying, doctor, there is too much of work.
Yes.
So either there is no work or more work, stress. Then financial stress is the next one.
Yeah.
If somebody doesn't have money, they say, doctor, I have no money, so I am under stress. If they have more money and they have losses in the business, like many people suffered in say COVID times and other times. So financial stress, personal stress, too many personal stresses now. So that has gone up. Sleep. Sleep is one of the important things we all know.
Yes.
But as successful a person gets, the sleep reduces because they need to do late night parties, chatting, whatever.
They want to live multiple lives in one lifetime.
Correct. So the lack of sleep. And then, other things are this fast food. Many of the foods can trigger migraine attacks like Chinese food, Coke, chocolates, cakes. Many of these things, not in everyone, but some people are sensitive.
So how can you figure that out? Is there a test for that or?
For the food stuff, generally the patients will know because they have been doing well for 1 week. Suddenly they go out and have some, Chinese food or they love chocolates. They have, some chocolates and after that when they reach home, they start having headaches.
So technically there is no test for that.
There is no test for that. I already mentioned.
Self-aware.
So most things but you need to spend time with the patient may not know. So we have to ask leading questions to the patient that, okay, in the last 1 month, how many times you got? So she will say, okay, 3 times I got. So just can you recollect the days you got headache? Did you sleep less the previous night? Did you take any extra stress that previous night?
So you do kind of a lawyer's job also.
That is what it is. That is what neurology is. So more questioning, we have to inquire more.
So did it ever happen that with your question, the patient got more stressed?
No, I think that basically you have to take the person into confidence. Because many times we go into personal territory also. Like stress means, many things are personal.
Yes.
So once we build up the rapport and, only then we can go for these kind of questioning. And we need to explain to them, see, this is what, it's just an inquiry. Doesn't mean that you have to say yes for all the things. If there is no, you must say no. Then we look at other issues.
Nice. So you touched upon sleep. That is a very, very big area where a lot of us struggle, including myself. And what is happening right now in the market is many brands are coming up where they are trying to sell, medication for sleep. More or less, they are using melatonin in that. So I want you to explain to the viewers what exactly the importance of sleep is, how one can tackle that, and why very randomly without consulting anyone taking up these medications from these brands can do more harm than good to you.
Yes, I think sleep is something, which is free, but the most important. All the good things in the life are free, whether it's oxygen, water, or natural, good, healthy sleep. How much one should sleep is 7 to 9 hours. And it is not a random figure because there are multiple studies which have been done. And it has been shown that people who sleep less than 6 hours, I'm not trying to scare you. So basically those who sleep less than 6 hours, they have a higher risk of getting diabetes, high blood pressure, heart attacks, strokes, and even cancer. And as a result, people who sleep less than 5 hours or less than 6 hours every night on a regular basis, they have a shorter lifespan also.
Yes.
So longevity also is less. So it's a serious issue. Sleeping less or inadequate is, somebody can brag saying, no, I sleep only 4 hours, but I'm totally healthy, I'm well. And they can quote example of some Superman, somebody in the history that that person also slept only 4 hours and 5 hours. But each person is different and we haven't cross-checked and verified. Some people may just claim. But studies are research studies. So sleeping duration normal is 7 to 9 hours. And that too only at night. There are people who do night shift duties.
Exactly. I was going to come to that where people say I sleep 7 to 9 hours but in 2 halves.
Correct.
That is not equal recovery, right?
That is not equal. So that sleeping in 2 halves is called as biphasic sleep.
Okay.
So biphasic sleep means you can sleep once in the day and once at night. That is normal only in 2 age groups. Children below 5 and people above the age of 60.
Okay.
So if somebody is 30-year-old and says I'm sleeping in the afternoon 3 hours and night 4 hours, that means you are accepting that you are 60 plus already.
Okay. And that also plays a direct impact on the REM of sleep, right?
Yes.
So, for example, let's just say I am someone who sleeps 8 hours. I sleep 4 hours in the afternoon, 4 hours at night. Will I have a greater REM at night in comparison to day, or how is it?
It is definitely, because we are talking about the sleep quantity and the sleep architecture.
Okay.
So architecture means it is the slow wave sleep and the rapid eye movement sleep. So the deep sleep also we need equal proportionate amount of REM sleep, that is rapid eye movement, NREM, non-rapid eye movement, or the deep sleep, relaxing sleep. And that is, that can happen only at night because the natural secretion of melatonin happens at night between 9 to 11. So the best time to initiate the sleep is between 9 p.m. to 11 p.m. And then add 7 to 8 hours from that time and then get up.
Yes.
So one more thing is to maintain a regular sleep hygiene. So whatever time one sleeps, that is fine. You can choose 10 p.m. or 11 p.m. But if someone sleeps,
to that schedule.
Yes, but if somebody sleeps at 9 p.m. one day and the 11 p.m. next day, even they sleep normal duration of 7 to 8 hours, they have higher risk of all the diseases that I mentioned.
Yes.
Half an hour difference is fine.
Okay.
So if somebody chooses 10, so between 9:30 to 10:30 is fine.
Okay.
But beyond half an hour variation, it spoils this thing.
The sleep quality, you can
Sleep
say.
quality and all the hazards.
And also how important it is. I am a personal advocate of this, saying no blue light before sleep. Or if you actually need to, then use blue light blocking glasses. What is your take on that, and how much do you feel that actually helps?
That is helpful because the scientific basis is the melatonin secretion happens in darkness.
Yes.
So when the retina is exposed to any light, especially blue light, the melatonin secretion may not happen. That is number one. So that is why natural and good sleep should be in a dark room when there is no lights on. Some people feel scared with the lights off, but that is different. But generally light should be off, cozy, good temperature in the room. And 1 hour before sleeping time, the devices should be off, which is impractical in today's world.
Yes.
But whatever is possible, because if you are browsing internet also, possibly the content should not be which is
very brain stimulating.
Correct. So that is what is important. And definitely during sleep, the phone should be in silent mode, unless you are a doctor like us, expecting a call from emergency. Yes. So we also have on-call days and not on-call days. So at least not on-call days, we also can keep the phone in silent mode because other doctors are covering the emergencies.
Yes.
So that should be the important thing. And other thing is having dinner, say 3 hours before sleep time. Many people just say, doctor, you're just saying something which is not practical. If I'm sleeping at 10, how can I have dinner at 7? But there are multiple benefits of that.
Yes.
One is
your digestive tract is not as active, right?
Correct. So if we give, let's say, more than 12 hours of, the free time or when there is no food in the gut, then it is good for the gut. And also it is good for what is called, nowadays many people talk about intermittent fasting.
Yes.
And restricting the time window of eating.
Yes.
So one may not be able to do, that is strictly like 16 hours of fast and 8 hours of eating.
Yes.
But if one can't do that, even if you prepone the dinner from let's say 9 p.m. to 7 p.m. and have your breakfast at 9 next day, so that's a 14 hours break.
Yeah.
So that is good for control of sugars, reducing weight.
Yes.
And there are studies that show that one
fasting has its own benefits too.
benefits.
Yes.
So, so this is something which, and also people who have GERD, acid reflux, for them also it is useful to have early dinner rather than late dinner, because reflux will be much more.
And also your choice of food at the end of the day matters, correlates with your sleep, right?
Definitely, yes.
So what kind of foods would you suggest to have for people to have before sleeping? I personally, as far as my knowledge goes, walnuts and watermelon and watermelon seeds help with the secretion of melatonin, right?
I think they are good. So basically our diet should be more rich in fruits and vegetables and
Healthy
less
fats?
and healthy fats, and less in the carbs, like we having too much of rice or roti
they
at
are
night.
highly inflammatory, I believe.
Correct.
That's
So they should be minimized,
cut out.
and maybe a small amount of curd also will be useful.
Okay. Curd relates with relation to the gut or
Gut.
Okay.
Gut, and also that's like soothing,
Yes. Do you also personally believe that gut health kind of directly relates with mental health?
100%. So I believe, because I am a medicine, student of medicine and research. So there are now multiple studies are there which show that even as serious diseases like Alzheimer's disease, where people become demented, they can't remember.
Yes.
Parkinson's, where people have difficulty in moving. Almost all the serious conditions are linked to gut health. There is something called as gut microbiota, means we have healthy microbes,
Yes.
microorganisms in the gut. And if any inflammation happens, which disturbs that gut bacteria, and that can happen with what is called as ultra processed packaged foods, which is today the
Yes.
the go-to thing,
Yes.
and that is spoiling our gut, causing a lot of inflammation,
Also a lot of imbalance in the hormones, right?
hormonal imbalance, and they are rich in sugar, which is unhealthy.
Yes.
So multiple ill hazards of those ultra processed packaged foods affecting the gut, and also keeping on eating. Somebody is watching, let's say IPL or whatever,
Yes.
I saw one ad where one kid is ready, match ready,
Yes.
and that is having some soft drink, some lay, and various unhealthy stuff.
Yeah.
And then you'll sit sedentary life, eating till late night.
Yes.
So that is the most
I
unhealthy.
feel
way
all
of,
these preserved food are also very hyper palatable.
Yes, because see, to preserve if anything has a long shelf life, that means it is not healthy for us. If something is perishable, it is healthy.
Okay.
Otherwise, that means even bacteria also can't survive there. That means
Yeah.
how can humans survive? They can't eat that food. So a lot of preservatives or any added thing, like either they'll add sugar or too much of salt, too much of oil, something they'll do to make it last longer. So we have to avoid, and we have to read the label. Many times we just go by the endorsements by celebrities and say, okay, fine, if such a celebrity has had it,
Yes.
but they don't have it, they're just doing an ad.
Advertise it.
Okay, so that people don't understand. So we should read the label. कि उसके अंदर क्या है, how much of sugar, how much of which oil they have put, what artificial preservatives.
Not just the calories, but people need to understand the ingredient label also.
Ingredients,
I feel.
yes. If you can't make out the ingredient, we should not consume it.
Yes. So let's talk about your journey into running and living a healthier lifestyle. What motivated you to do that?
Yeah, that is always a big question, that we look for motivation for others.
Yes.
So I had good examples, like one of my senior colleagues, possibly you know him well, Dr. Ravi Andrews. So he has been a gymmer for 25 years plus. So he was my senior in college also. So he is one of the motivators. Then in my own batch, I had batchmates who were very good in running, so they kept on motivating me. But till something enters your own brain,
Yeah.
that I need to do something, you can't do something on a consistent basis. Somebody can push you to start, but maintaining it, sustaining it, it needs own motivation. So then, I was very good in working, very good student earlier on, and then a lot of research papers I was publishing, teaching students. So I was happy with my academic life and everything else, and my clinical work as a doctor. But as a result, I was gaining weight. I had reached close to 100 kgs. And then this was not too long back, just 3 years back.
Okay.
And I was 49 years plus, entering my 50th year.
So this
And
was
I had-
around the COVID time.
COVID time, yes. Where luckily the patient load was less for us
Yes.
in the core neurology area. And then, so then I was thinking what I have been doing with my life. I've been doing everything, but the most important part I'm telling my patients to do, but I'm not practicing myself.
Yes.
And I had no other illnesses by God's grace, but I was overweight and almost nearing obesity. Then I thought I had joined gym, but somehow, gym I was enjoying, but not so much. Then one day I thought, let me try running. So first day, it was November 2020, so about 2.5 years back. I could barely manage to finish 5 kilometers with great difficulty. Somehow I finished.
Okay.
Then, but I said, okay, next day my legs were aching, but I said, no, again I have to go.
Yes.
So again I pushed myself. Like this I did for some 15 or 20 days. The pains started coming down.
Okay.
And my pace also, which was like 9 or 10 minutes per kilometer, had come down to around 8 to 8.5. It was coming down. And then within a month, I somehow managed to finish about 10 kilometers by December. And then another month later, on 26th January 2021, it was Republic Day. So about 2.5 months from the time I took up running, I could somehow finish 21 kilometers also. Then that gave me confidence that yes, I can run. And by then I had lost about 1 kg weight also. So I realized, and it's not only running, because when you do some fitness activity, you also feel that diet is important. So I was reckless eater earlier. I would eat anything, samosas, 4-5
all of this while being in the hospital.
In the hospital, when you are working very hard.
Yes, you justify that to yourself.
You justify that you're working so hard. So you can have 1 or 2 soft drinks, 1 or 2. It's only 2 soft drinks, 2 samosas. Yes. But they all add up, unless we start counting the calories, how much you have eaten, much more than what you require.
Yeah.
So then I just cut off all those unnecessary stuff, focused on my own food, cut down the carbohydrates also. So that was also helping. And then there was no looking back. So I started enjoying running. So in the year 2021, which was the full year of running, I did 339 times more than 10 kilometers, out of which 69 were half marathons and 1 full marathon in that year alone.
Okay.
And then continued in 2022 also. I reduced the mileage little bit because I read that too much of running mileage is also not good for our own health. So consciously I've been cutting down, which has again come down further. So now it's like only 50% of days I do 10 Ks. Now other days I do 5K or even lesser. At the same time, again I rejoined gym also because I was losing muscle.
Yes.
So then, I spoke to my colleagues and they told
senior Ravi Andrews is helping you.
And then he said, no, definitely you should increase the protein and also start working out in the gym, build up your muscles.
Yes.
So that journey is again 5 months now. Okay. So it's now running plus strength training. So
that
3 to 4 days.
That is the perfect combination.
Yes.
In my
and
opinion.
The diet removed the sugar and the junk.
Okay.
So from 100, now I'm down to 71 kgs. That's about 29 kgs loss in the 2.5 years. And also my timing has improved quite a bit. So this year I ran 3 half marathons in Hyderabad, various locations, registered timed runs. And I could finish in less than 2 hours, 1 hour 55 minutes.
That is very amazing given for how much time you have started running and your age.
Yes.
And how stressful your work life is also. So tell us how this transitioning towards a healthier lifestyle in terms of eating, in terms of being active, how much has it impacted your day-to-day life activities and also your cognitive function?
Yes, that's a very important question because many people ask me, Doctor, you are running so much and obviously you'll feel tired. How can you focus in your work? Because you have to see so many patients and, use your brain. You can't make a mistake. But I should tell, everyone that running or any exercise, for me it's running, it actually makes your brain much more active. So I feel much more active physically as well as brain-wise. And I'm more focused in my work. I'm enjoying my work. Earlier I was getting fatigued by the end of the day. Today also is end of the day. But, I can still, so my brain looks more active. So cognition and the brain functions do improve after running. It doesn't make you tired. Also, some people say if you run too much, you'll feel hungry all the time. You'll tend to overeat. But that is not the case. So exercise actually will control your hunger and satiety in such a way that you don't overeat. Always you'll eat what is required. So overeating is not a result of running on a regular basis. And definitely, as I said, food control also happens automatically along with running.
Yes.
And physically also, first few months, as I told, my muscles used to ache. I used to feel tired. But now, I have had several days where I ran half marathon, came straight for ward rounds. So 1 to 2 hours of rounds and then seeing 20, 30, 40 patients after that.
Yes.
So it's easy, but of course, lot of hard work goes into it.
Yes.
And one can achieve that. Say, with consistent running, that will happen.
Yes.
On the parameters, one more parameter which I noticed was our resting heart rate.
Yeah.
So resting heart rate was normal for me earlier, also 72. But now it has come down to 40 and 41 and 42.
That is athlete level resting rate, right?
Yeah, definitely.
40s.
Yes. And those who don't know, resting heart rate is one of the parameters which decides your, how much risk is there for you to get heart attacks or strokes or cancer, and how long one can live. Because the number of times our heart can beat in a lifetime is fixed.
Yes.
If it is beating at a faster rate, the chance of living that many years is
that's a perfect way to put it.
It's one of the research has shown that actually. So if someone's resting heart rate is lower, they have a higher, longer lifespan also. So running is one of the things, exercise by which one can reduce the resting heart rate also.
Yes. That's nice. So now let's move on to a slightly more complex topic of how brain strokes and Alzheimer's and Parkinson's are getting very common. I'm hearing about it very often right now. So what are the early stages or early symptoms that one can, feel and understand and come to you at the earliest and nip it in the bud?
I think it's very important because as a doctor, even though I'm a doctor and I'm trained to treat diseases, but I prefer that people don't get diseases.
Yes.
This is my now 30th year as a doctor this year, because 1994 I saw my first patient.
Okay.
So I'm waiting for a day when I will have no patients in my OPD. I'll be the happiest person. I'm a doctor, but I want no one to fall sick. So preventing a disease is more important than treating a disease. So how can one prevent a disease? And let's look at stroke. Stroke, you mentioned. Stroke is one of the three killers, main killers today. Other two are heart attacks and cancers. So top three diseases which make people disabled or make them die earlier before their time is stroke. And the risk factors for stroke are well known. We see many people, having heart attacks, younger people. Same thing is happening for strokes also. Stroke is a condition where people get suddenly paralyzed on one side. They are totally normal one moment. The next moment, the hand and leg stops working. The speech is lost. And after that, they are disabled. So the risk factors for stroke and heart attacks are same. It is high blood sugar, high blood pressure, high cholesterol, smoking, excessive alcohol consumption, not sleeping adequately, stress. Some are non-modifiable, like family history of stroke and our advancing age. We can't change that. Mm-hmm. But sedentary lifestyle. So many things we can change. So few tests in a year, like say somebody can check their blood sugar, blood pressure, cholesterol once in a year.
These can be done every 2-3 months also, right? These are not very difficult to get them done.
Not
blood
difficult.
Sugar, so you can monitor at home.
But you will be surprised, when I see, let's say, I see one new case of stroke every day.
Every
day I see one new case of stroke in.
And at what age group are they usually?
And in our books, when I learned MBBS, it was told that they should be 60 plus. But I am seeing today, every decade, the patients are younger. So now they are in 30s and 40s, many of them. So when somebody crosses 60, I tell them jokingly, now the risk of stroke is less for you because you have lived for 60 years without a stroke. So many people, younger people are also getting. So in that, stress, lack of sleep, those factors, and then lifestyle, which is, where unhealthy food is being consumed, sedentary life. Most of the jobs are sitting jobs.
Yes.
And people have to make an effort to exercise, but that is 80% of people don't do exercise today.
Yeah.
Even though questions are asked. Many people are asking me questions, doctor, excessive running can kill people. But then I ask them, how much running do you do? So doctor, I haven't run. I thought when somebody is doing 21K or 10K daily, they can ask this question.
Yes.
But somebody who's not even running, why are they scared of overkill?
It's like this, when we watch IPL, we are the first one to say that shot should have been played that manner, but Correct. We don't know how to play that shot.
Exactly. So at least let you start with 4 or 5 kilometers. That is very safe. Up to 5 kilometers running is totally safe.
Yes.
Anyone can do and should do. If not running, at least brisk walking. Because older people, of course, there's a risk of knee joint damage. In older people or those who are overweight, they can start with walking also. So this is how we can prevent the strokes. But okay, now despite all the measures, if somebody has got a stroke, so the symptoms should be recognized fast. And to recognize fast, we should remember FAST, fast.
Okay.
So F is for the face. If the face is crooked and going to one side, that means it could be a sign of stroke. A is the arms. So make them raise the arms like that. If an arm is weak and falling like that, it could be a sign of stroke. The third letter in fast is S, speech. So if someone is not able to speak clearly, or if you are talking to them, they are not able to understand, it again could be a stroke. And the T is the time. Why time? Because brain neurons rapidly die if the blood supply is blocked. And we only have 4.5 hours to give a medicine called clot buster therapy, thrombolytic agent. And that can cure a patient. So wherever a person is, if he's having any of these symptoms, rush to the nearest hospital. Hyderabad, we are lucky that every corner there is a hospital, and all doctors are aware of this clot buster drug.
Okay.
But time is the limiting factor. They just need to do a simple CT scan. Even MRI is not required to decide this therapy.
So if they are able to reach you within 4 hours of detection, you can sort the problem.
We can sort the problem out. So and most leading hospitals have this facility. So it's not something which is unique in some hospitals or only some cities. Even in a district level, it can be done. They can give the injection and then transport the patient to nearest city. That also can be done. So injections are available everywhere.
So let's get into a very interesting question that I have for you, and I think that is going to benefit our viewers also. Let's talk about mental health of the current so-called Gen Z, the latest, youngest generation that is out there. They are having a different state of mind, different mental issues, and they are having various different problems because of that. So can you take us through that?
Yeah, definitely. As I mentioned that when I see people, I hardly see somebody who's telling that I am totally stress-free or I am totally happy with what I have at the moment. So one of the things that is common now is aspirations. People want to achieve too much and too early, which were not there in our parents or grandparents' generation.
Yes.
Which may be good in a way, but if it becomes an obsession, then it may not be good, because people need to work extra number of hours, and if one doesn't achieve, then dejection and depression happen. And then second thing is the peer pressure. Earlier there was no social media, so if if my friend has gone to Mumbai and is doing something, even the phone calls were not there. So only when we met after 4-5 years, we would ask, okay, what are you doing? Today, the moment somebody goes for a vacation to Maldives, the next moment the pictures are posted.
Yes.
And that is putting undue pressure on the friends also. And we see, and then a lot of other pressures are there. If somebody has posted a picture on Facebook and the likes are only 10 or 15, then I have had people who go into depression, that my posts are not liked and my friends' posts are liked by many people. And knowing very well that we can buy the likes, okay, but still, even if there are various kinds of pressures and tensions have crept in their lives, which were not there earlier.
Yes.
Okay, and that is one of the things in this current generation. And the aim to do too many things. Earlier, our parents went for the job, came back at the right time to home, spent time with us, teaching, supervising, whatever, have dinner and sleep.
Yes.
Today, there is an after office life is there.
To live.
So that life is like, again, it's a peer pressure. I went to this place, this pub, and I had a great time. Movies, so those things have become more. All this take time also. Money also is required.
Yes.
So these are the other things which many people do. And I also feel that the alcohol addiction, or smoking, they also have gone up. I have seen now youngsters, teenagers also smoking.
Yes.
Smoking, we all know it's not good, but these are all pressures of the peer pressures, and people are indulging into that. That definitely can lead to health issues.
So you brought up a very strong term called addiction, and addiction does not necessarily mean to alcohol or smoking or anything. I wanted to elaborate and lay emphasis on addictions, because I personally have read this very recently and I could relate with that a lot of times we obsess and get addicted over a certain activity, and that secretes certain hormones in our brains. And then we reach a point where without doing that certain activity, we will not be able to go about our day. Right?
Definitely. You're talking like an expert, and it's very correct. So in our brain, there is a reward center, basically. Yeah. So anything that we are addicted to, some people are addicted to, let's say, smoking, alcohol, or maybe sexual activity, whatever. And certain foods like too much of sugar, they all act on the same reward center. And the same chemicals like dopamine, endorphins are produced.
Yes.
Now it is up to the individual to decide what addiction is good, what is not good. Because once the addiction starts, then one has no control. It may require treatment. So if someone has to get addicted, it is better to get addicted to exercise, gymming or running, because they are healthy addictions.
Yes.
Whereas alcohol or drugs or smoking addiction is definitely unhealthy. And we all know, even those who are not addicted also, or even those who get addicted, many times they have an insight, but they're not able to control it because they are addicted.
Because I think there is self-justification in their minds for
that. That's why it is there, because they will try to justify somehow, that this amount is safe, that amount is safe. But I want to tell the viewers, no amount of alcohol is safe. Many people say alcohol is good for your heart. Then I said, in all of the cardiology guidelines, why have they not mentioned that start taking alcohol? They mentioned that 150 minutes of vigorous exercise.
Cardiologists should be sitting in alcohol shops.
Correct. So none of the cardiology guidelines mentions that to protect your heart attacks, you should consume alcohol. They'll mention everything: sugar, BP, cholesterol, exercise, everything is mentioned. But they don't mention start drinking so much of red wine or whatever alcohol. So I think that is because many doctors also drink. So that is why those doctors, obviously, to justify their own drinking, they may tell you that drink.
Yes.
But no amount is safe. But if someone can't do social functions, whatever, to keep it to the lowest minimum possible.
Yes. And also in the wake right now of you can say fitness industry, or you can call it anything, there are newer products coming that help promote cell regeneration, right? I don't know if you're fully aware, you might be, but how much do you think those things actually have a greater impact? Like, for example, there's a product that's called NAD. It's a combination of niacin and vitamin B12 and so on and so forth. It's a cocktail of a lot of things. And I see the supplement industry slightly wavering towards that. Stuff like NAD, nootropics, stuff like that. How much do you think is beneficial?
I think in one word, they are not beneficial.
Okay.
So number one, the problem is that they come under nutraceuticals, where vitamins and any food, protein supplements or whatever. So there is no regulatory bodies, authorities, which supervises them. Second thing is the price fixing. Like for life-saving drugs, we have an authority which fixes the price. One cannot sell more than that. So the margins also are much higher there.
True.
So they can get the biggest celebrities to endorse them, because they're going to recover that money too soon.
Yes.
So as a doctor, I would not suggest those supplements blindly. But there could be a patient, if somebody is a pure vegetarian or strict vegetarian, not taking any non-vegetarian, they may be B12 deficient. Then there is a point in giving B12 supplements in them. Or if any vitamins or somebody is not a good eater, then definitely somebody cannot eat too much of chicken and fish or any protein. So protein supplements may be required in them. So my advice to anyone who wants to take these supplements, consult your nutritionist, dietitian and a physician, and then only go for long-term use of those supplements.
True. And also one more thing I had come across recently is, because our current generation, not just current generation, people in the 30s, 40s, my parents, all of us struggle with sleep, right? And very conveniently, they want to find out the root cause of it on Google or YouTube. And one of the top researched and suggested supplement is Ashwagandha, for many benefits. But also, like we spoke about the whole addiction, many cases I have come across where the body is so much dependent on Ashwagandha that they're not having a regular dopamine release because of that, unless they take it. So how much do you think that is true?
See, it is not to hurt the sentiments of the practitioners of Ayurveda or this thing. Ashwagandha, there is no hardcore research supporting the claims it has. And on the contrary, I have seen cases of damage to liver and other parts with Ashwagandha also. So one has to be careful. That's what I can say. And there are better method. Even the allopathic medicines that we use for treating sleep, like say benzodiazepines.
Yes.
So they are not also safe. So they should not, because people get addicted. Not addicted. The word uses dependence.
Yes.
So once somebody starts drugs like alprazolam or say diazepam, which is sold as Valium Compose, then they can't sleep without them. If they use for 1 or 2 months, they have to use for lifelong.
Because back of the mind, they know that when it doesn't come, I have that to reach out to.
And if they stop, they can get withdrawal symptoms.
Yeah.
So any sleeping pills, try to avoid, as much as possible. If you have to take it under medical supervision. and the least number of days possible. Natural sleep is still the best. And once somebody gets dependent on the sleeping pills,
There's
it is
no
not easy
coming
to
back,
come
yeah.
out.
Thank you so much for being with us. I got to learn a lot. I'm sure our viewers also got to learn a lot from this. One last question before we wrap this up. What is that one thing, one emotion, one learning, or whatever, there's one small thing that you're going to take away with you when we are done with this session?
I think most important is that one has to be positive and to adopt healthy lifestyle, whether it is healthy diet or any healthy activity, physical activity like running or exercising. There is no age criteria for that. Many people feel that I'm too old to start anything. So the best time is now, not tomorrow. And the best motivator is you yourself. You can motivate yourself. And that's what it is. And then lastly, we have to prevent diseases and not wait for diseases to come to get treated by the doctors. Avoid the doctors as much as possible by being physically fit and adopting a healthy lifestyle.
Amazing. So guys, if you like today's podcast, then
Please like it and then also share it
comment and subscribe to Project You.
for more similar podcasts in the future. Thank you.